Hello and welcome to Pre-Reg Shortcuts. This is Marvin, the Managing Director and Clinical Tutor of Pre-Reg Shortcuts. Today I'm quite excited because I'm going to go through a key area that comes up in almost every GPHC exam, and it's knowing your paracetamol and ibuprofen doses in children. So in almost every exam you will get a question on this, so please, you need to learn these doses not only for your exams but also as a practicing pharmacist, because you get a lot of questions from parents asking to buy either ibuprofen or paracetamol, and they need to know what doses to give the children. So here are a few general principles that you need to learn. You do not give paracetamol to babies over the counter that are less than 2 months. So it's only licensed from 2 months plus. That's when you could sell them over the counter. If the child is less than 2 months, then they need a prescription. So you've got two types. You've got the infant syrup, which is normally for children that are less than 6 years old. So it's important that you know the dose in an infant syrup, and also you know what the dose of paracetamol is in a 6+ syrup. So in an infant syrup, in 5 ml dose, paracetamol is 120 milligrams. So 120 milligrams in a 5 ml dose in infant syrup, while in your 6+ syrup, it's 250 milligrams of paracetamol. Why is this important? Because you're going to find out later on it's important in terms of converting to milligrams, or you could either have the dose in milligrams or you could have the dose in milliliters. Another thing you need to know is the maximum number of doses with paracetamol, especially for temperature, is 4 doses in 24 hours. Okay, so maximum 4 doses in 24 hours. You've got the two types. You've got the infant syrup for Calpol or paracetamol. For less than 6 years old, 120 milligrams of paracetamol in a 5 ml dose, while for your 6+, it is 250 milligrams in 5 ml dose. Now, just to make this so easy, is I think the best way to learn your doses, you could either learn these doses using the BNF, which I find a lot complicated because you have more ages, more doses in the BNF, and it's very black and white. Or an easier way or quicker way is to learn from the bottles in your pharmacy. So the way I do it is you learn the doses at the back of a Calpol bottle or the back of a Nurofen bottle in the pharmacy. So let me show you what I mean. So that's a picture for you. So I've got Calpol, which is less than 6 years old, and then Calpol, which is 6+. So the reason why I prefer this method is because you have fewer ages, and I'm going to show you that now, and then I'm going to compare this to what you have in your BNF. So the back of the Calpol bottle, 3 to 6 months is 2.5 mils, maximum 4 times a day, 4 times in 24 hours. If the child is between 6 months to 24 months, then it's 5 mils, then 7.5 mils, then 10 mils. So it's very important. It's so easy to memorize. You just have 1, 2, 3, 4, and most of the time in the exam you will get questions on one of these. So just look at the back of the BNF. You need to the back of your Calpol bottle. Learn those doses with the ages, and this is in milliliters. And then you could use this, knowing the conversion that we spoke about. You can then convert this to milligrams. So if you might get a question in the exam in milligrams, or you might get a question in milliliters. So for your 6+, remember, it's 250 in 5 mils. And 6+ is easy because you just have 3 ages. You've got 6 to 8, which is 5 mils, 8 to 10, 7.5 mils, and 10 to 12, 10 mils. So on the top one, which is your children less than 6 years, you can see on the 2.5 mils for 3 to 6 months, but then you have 5 mils, 7.5 mils, 10 mils, which is exactly the same in terms of mils like the 6+, which is 5 mils, 7.5 mils, and 10 mils. So learn the back, look at the back of a Calpol bottle, and please learn these doses. So why is this better? The reason why it's better, why I find it easier, is because I'm going to show you what how the doses appear in your BNF. So this is a picture. So these are your paracetamol doses in your BNF. First of all, you have more. So a child 1 to 2 months, 3 to 5 months, 6 to 23 months, 2 to 3 years. So that looks a lot complex. And also it's given in milligrams. It's given in milligrams rather than mils. but you can do that conversion with what I showed you earlier. So you could, definitely you can learn both. It's important to learn both, but I just think this is a lot easier. And if at least you learn the back of these bottles, most of the time the exam questions, which I'm going to show you later, will come from here. So that's for paracetamol. Let's look at ibuprofen, the same thing. So this picture that I have here is from the SPC, from Nurofen SPC. So again, you can see there's a number of ages, a bit similar to the BNF, and you have your doses. With this, it's normally taken 3 times a day in 24 hours, right? So for your paracetamol, is a maximum of 4 doses in 24 hours, like we mentioned on here, while for ibuprofen, you can see on there, it's taken 3 times a day in 24 hours. So the same principle. The BNF is a lot complicated, but if the simplest way to do this is to get a Nurofen bottle in your pharmacy, look at the back of that bottle, look at the ages, and look at the doses, learn those doses. So here's a picture for you. So 3 months and over, 2.5 ml dose for fever caused by immunization, fever, pain, cold and flu, which is the most common one when parents come to your pharmacy. 3 to 6 months, you give them 2.5 mils 3 times a day. 6 to 12 months, 2.5 mils 3 or 4 times a day. And then 1 to 3 years is 5 mils 3 times a day. 4 to 6 years, 7.5 mils 3 times a day in 24 hours. So especially the last 3, 1 to 3 years, 4 to 6 years, 7 to 9 years, you normally do get questions in the exam on these. So please, while you're in the pharmacy, whilst you're working, take a Calpol bottle, take a Nurofen bottle, and just memorize this stuff. So this is an example of how it appears in your BNF. Again, more complicated, boring, black and white. It's given in milligrams, and there are a lot more ages. So start off with your bottle in the pharmacy, learn that, and then you can move on to memorize all of this in the BNF if you want, if you have to, or if you want to. So that's really it. Very quick video for you. So let's look at an exam style question. All right, so here's some questions you could get in the exam. So a mom visits your pharmacy with a 3-year-old son who has had a temperature since coming back from nursery. She buys some Calpol from your pharmacy and asks what dose should she give the 3-year-old son. What is the most appropriate dose to administer every 6 hours? So what do you guys think this is? So again, if you look at the back of the Calpol bottle, if you look into your BNF, it is 180 milligrams. Okay, so 180 milligrams is what you give to a 3-year-old child with Calpol. So if I go back and I can show you on here, you can see 2 to 4 years at the top, it's 7.5 mils, which is equivalent to your 180 milligrams. So that's the first question. Second question, we're going to look at another example if that's given in mils. So the first one was given in milligrams, or you could get questions in mils. So Mr. Smith calls your pharmacy for some advice. He wants to give his 4-year-old son some ibuprofen, but he's not sure what dose is best for this age. What is the most appropriate dose of ibuprofen for his 4-year-old son? So what do you think the answer is? The answer to this is the bottom one, the 7.5 mils 3 times a day. A says 4 times a day, but it's not 4 times a day for that age. It is 3 times a day. So the answer is E, is 7.5 mils 3 times a day. So that's exactly what you need to learn. Very important. Always comes up in the exam. Learn your doses, your paracetamol doses, your ibuprofen doses, not only for your exam, but also as an effective pharmacist. So thank you so much for watching this video. Once again, if you found this video useful, please give the video a like, give it a thumbs up so that I know you're finding this useful, and then I could make more videos. Make sure you subscribe to our YouTube channel if you haven't yet, and then in the description of this video, I'm going to put a link, and it's a free link to join our free mailing list where you get loads of daily clinical and calculation up-to-date GPHC style questions to help you pass your exam. So thank you so much, and I look forward to seeing you in the next video. All the best in your revision. This is Marvin from Freeway Shortcuts. Bye.